Okay, I will tell Winnebago County Community Mental Health August 7th, 2024, and it's 2 p.m. First roll call. Mary Ann Hottie, present. Andrew Bradshaw. Dr. Copeland. Dr. Giardini.
Here. Here.
Kip Cooner.
Here.
Margie Lindmark.
Present.
Tim Neighbors.
Here.
Jeff Niels.
Here.
Mohammed Yunus. Before we move on, I thought I'd take this opportunity to just let, we have 2 new board members today. Andrew Bradshaw. And first of all, if you'd like to just tell us a little bit about you and why you wanted to be on the Winnebago County Mental Health Board.
Hello, again, my name is Andrella Bradshaw. I'm a licensed professional counselor. I am currently practicing at Counseling Associates of Practice. Prior to that, I was at an agency formerly known as Access Services in Northern Illinois. They are now Service Inc. They work with individuals with intellectual and developmental disabilities. Prior to that, another organization called Family Active. State funding, what can you do? So I've spent the majority, pretty much all of my adult life working in social services in some form. I don't know that I actually wanted to be on the board. I think I make a lot of noise. And so I was called and said, hey, how about we do this? So here I am. Thank you.
Thank you. Jeff Niels, would you like to just give us a little bit about your background?
Fair number of years on the Janet Wallace board, including when we merged with Rosecrans. And my career was in law enforcement, 34 years in the police department, my last 5 chief. That's what brought me here today. I saw an article a while back about there be some openings. And I mentioned it to somebody because of my Wallace and police back. And somehow that got up to the mayor, and he thought, it's my fault. So, right, glad to be here.
Thank you both. Time and talent, we really love. Okay, moving on. Yes, I'm going to go to the public comment. And we do have one person, Mary. And just 3, don't be nervous. 3 minutes, and the board doesn't generally give feedback.
Yeah, this is Mary. My name is Mary Platt. I'm a mom. I have an adult son with autism. He also has mental health issues. We used to go to Dr. Newman. Health was gone. There are no outpatients in the hospitals. Of course, you know that. I tried air Rosecrans, I believe, a couple of times. They will not take adults. Now he had some. He's been on some things, whatever, you know, one thing that the psychologist had to prescribe. And we went to Freeport, they closed theirs. I'm now in Mississippi. It takes 4 to 5 months to get in there. I just want to get a med check. He's on like different meds. This summer, something broke more. It's not a formal diagnosis. He has OCD, like unbelievable suppression. And there's our services for our services in probably 20 plus miles for adults with autism and mental health issues. I've been working through my crisis prevention network. They said the same thing is going on, and then that this problem is going to be escalating. I just happen to be a big mouth and I'm very much loving for my son to advocate. And I access, I'm very familiar with in yeah. But the thing is, I thought I need to come and make an awareness that there are no services. My son, there's a ton of them for children. I saw tons of places. When they hit 22, I guess they're on mental health issues. Anyway, that's my awareness, just that you guys know I want to be in contact. find out what's going on, what we can do. Pretty big town, Rockford, and at, Mississippi Center, which serves Freeport and Rochelle and some outlying areas. I had to make my appointment, I went right from Freeport over there, made my appointment in the spring, and I'm not gonna be able to get in until September. I can't even do med checks for anything. So that's my bottom line. We need services for, I don't know where it is for the developmental community, maybe Rosecrans, where center, or whatever it takes them, but I tried 3 times, they will not take the adults with mental health issues. So that's my thing, making you aware, and thank you for your time.
Thank you. There are no presentations today, so we'll move on to our monthly activity report.
Thank you. Yeah, I'm gonna keep it brief because we actually have some updates to give you in the discussion part of the agenda in terms of what's happening with the Accelerator Award program and also on our communication side of things. But I will just note that we have fully executed all of the contracts for the core program grants for program years 4, going some of them 3 years, going into program year 6. That ended up being 38 as a few of the awards for a renewal and a review for the same organization were merged into one of our primary contracts. There's 38 programs now as part of the core program funding, and those were all agreed on and entered, and all programs are moving forward.
Okay, thank you. And moving on to our action items, as you can see, we have quite a few actions. Okay. First one being, I need a motion to approve minutes from the July 2024 meeting. Mohammed and Dick. Okay. Any corrections, additions? Hearing none, all those in favor, please say aye.
Thank you.
Thank you. Next item is our resolution 2024, authorizing funded programs budget updates for program years 4 to 6. Jason, you will-
Sure. Did we skip over special conditions?
we did.
Okay. Do you want to go back to the special conditions?
We will go back. Okay, so it's FY 4 to 6 special conditions max.
Sure. So this special condition was for Boys and Girls Club of Rockford, their social emotional skill building program. And they were required to develop some type of tool that, or adopt a tool that allowed for the screening for their youth, that to basically identify those that fall within the target population. And they have identified a tool that they're using and sent a technical report summary with that for Hello Insight. You will see there's
Many
pages of what looks to be pretty quality statistical analysis, including construct validity and reliability measures. And that program is also here to answer any questions from you. But from the staff side of things, it is our opinion of the special conditions.
So I will need a motion to accept the special conditions.
So,
Any discussion? Hearing none, all those in favor, please say. Okay, moving on to resolution 2024 X1, authorizing funded program budgets updates for programs years 4 to 6. And this does involve roll calls.
Sure. So this is from RAMP, and you will see the memo attached. The primary change here is that there's a few smaller line items, but the primary change is moving what they had originally anticipated to be marketing dollars that they would contract out, moving that in-house to use in-house staff. And so that's the main adjustment here, with a few smaller things such as equipment and supplies that have a little bit of movement. And I believe there's somebody from the program as well to answer any questions.
So I will need a motion for approval of authorized and funded program budgets updates for the program years 4 and 6.
So.
So, here, okay. Any questions? Hearing none, I will do roll call. Andrea, or I keep calling you Andrea, it's Andrea Bradshaw. Do you approve? You can say aye or nay, same. Same, okay. Dr. Copeland, Dr. Jardine,
Yes.
Dr. Borstein,
Yes.
Kip Hooter,
Yeah.
Margie Lindmark,
Yes.
Kim Neal, Jeff Nielsen,
Yes.
Mohammed Yunus, Mary Ann Abadi, yes. Okay, moving on to resolution 24, who is authorizing funded programs work plan update for accelerator.
Yes, so under the accelerator program, the uh, College of Medicine SWAT program, which is really a partnership between multiple colleges and universities to build a social work pipeline for career pathways. They have requested essentially 2.5 years for their timeline. And when the accelerator program was drafted, that was to be expended within 24 months. So we're bringing that back to the board to determine if they should essentially be allowed to have the 2.5 year timeline. And so the resolution was drafted that should you approve this, we will be able to enter that work plan and funding agreement with them, allowing them for the additional 6 months to expend funds.
Again, I will need a motion for approval.
So
Here in a second. Any questions, Tim? Bill? First of all,
6 months.
there's a representative, there should be a representative here.
The reason that we need to extend it 6 months is to get the graduates. We had originally budgeted for 2 years, and that included going through the program and working with our partners. We learned that we didn't have funding to hire a coordinator to actually get. So that's why we extended it out. We're not necessarily ready to extend it out.
Hey, Carol, is there anything in the tea leaves with the extension that would put any future potential delays beyond?
That's part of our planning process because, as you know, 10 graduates. Everybody.
So unforeseen, but not impossible, that it would need even some more time. Is it a fair statement that not at the moment is it apparent that more time would be necessary, but it's possible more time could be necessary? Is that not a fair statement?
Yes.
So, question for Jason, how would that, excuse me, affect our budget schedule and our application schedule?
So the core program grants were essentially, our entire process is kind of on these 3-year cycles with the strategic plan. Now the core program grants have been aligned with that to have multi-year funding that goes 3 years. The accelerator awards were established as 2 years, but within that 3-year window. So actually with their extension of the 6 months, it puts them right to the end of program year 6, which would align, the timing of it wouldn't really go into another 3-year cycle. So I think it would align pretty well with our 3-year cycles to still kind of time out right as the core programs.
Any other questions? Okay, I need a motion for approval.
Yeah, we do.
Okay. Did I already do
You
that? Yeah, it is. Okay. So I will get roll call again. Andrea Bradshaw. Dr. Vogel. Dr. Jardine.
Yes.
Dr. Dorsey.
Yes.
Dick Clark. Marty Lindmark.
Yes.
Kim Neighbors.
Yes.
Jeff Nielsen.
Yes.
Mohammed Yunus.
Yes.
Mariana Abadi. Okay. And moving on to, resolution 2024. X3 resolution authorizing the Winnebago County Community Mental Health Accelerator Awards preliminary review determinations for applications received. So,
I can speak to this as we pull up the resolution if you want to read the.
yeah, I'm,
Section 1, but just as a reminder, these preliminary decisions for accelerator are basically a screening layer to see what should go to a full review for the board and what should not go to a full review based on it not meeting the criteria. Whether it be that it's not something that really is one-time funding, it's going to then add value in perpetuity if it's not aligned with the strategic plan and it's not serving the target populations the board has defined itself. So not a funding decision directly, but what should go to
okay. Whereas the Winnebago County Community Mental Health Board published a 3-year strategic plan and notice of funding opportunity for 9 sensitive projects to enhance mental health and substance use services in Winnebago County with up to $10 million available for accelerator awards, which will be granted based on statutory mandates, community priorities, and the proposed transformative impact on human, social, or physical capital. Whereas the Winnebago County Mental Health Board Accelerator Awards offer total funding available up to $10 million with a maximum of $2 million per proposal to be expended within 24 months. Whereas the Winnebago County Mental Health Board approved the University of Illinois College of Medicine Rockford Accelerator Award proposal for it is one.
That's the largest.
Number. Okay, so I'm just, yeah. Okay. So the Winnebago County Mental Health Board is willing to evaluate and explore the following accelerator award proposals. The Regional Office of Education, the Student Support Interventionist, the Rockford Area Arts Council, SPARK, at Washington Park. The Winnebago County Mental Health Board is not willing to review the proposal due to one or more reasons causing ineligibility for funding. Prairie State Legal Services, Prairie State Legal Services Medical Legal Partnership and Children's Advocacy Project. The ineligibility due to the criteria that it does not fit with the strategic plan and no value added in perpetuity. So those are the accelerator proposals that will be moving forward and one that will not. Okay, next is the rest. Pardon me? We have to this afternoon.
Yeah.
Do a roll call.
We're just.
Okay. Okay, so the board, we do need a motion, so that the board can decide whether or not they agree with moving the two proposals. Okay. And Tim, thank you. Any questions? Yeah.
Just for point of clarity, I'm sure of this, but the regional office of education, that's the program Scott Lindquist was here and presented in person about.
No, okay.
This is that program was already approved by the board. This is a new program. And just for clarity, everybody was provided proposals. I have a link, but just to give you a brief point on that, if you're asking is this program would be for social and emotional learning specialists. that basically they have some type of state funding that was awarded, that if they have local funding for 1 year, then those positions get carried over basically beyond that through state funding.
But it's the different program with the same organization.
Correct. Yeah, that's correct.
These have been reviewed by Jason's staff and some by these recommendations.
Yes, and also with Mary Ann and Dick as the president and vice president, and we've provided a link with the meeting packets, and anyone else can review that in advance. If you want to be clear here, so.
And the one that you're asking about is that it is sustainable in the fact that they have a state grant that and pick up the cost of all the personnel, but they have to have a local to begin. It's
So just for clarity for the new board members, will we all be asked to review these finals? Or just do subsets of us because there's only two of them?
So for the accelerator awards, we have opened that up to whichever board members want to participate, whether it's all 10 board members, or if it's a subset of board members, everyone will have an opportunity to score it should you wish to. There'll just be a deadline, cutoff moment, at which point we'll aggregate.
Did we get that already, or did I miss that? The prompt to go.
We don't have any current ones right now. We're in a lack point with all the ones that have previously gone to review have already been decided. So these will be the only two for review. If this passes today, then Mark will send out invitation to everyone probably early next week, if not this week, to open up the review process for all of you to score the applications. So providing the applications for you before this meeting is only so that you could have that information for this preliminary.
I guess I'm confused. Regional Office of Education, we approved that trailer that they wanted?
Training for the crisis response.
Yeah, they wanted a trailer, everything else to go with it.
no, that was just the trailer.
No, I don't think.
The Regional Office of Education had something like that too, where they were going to have
A trainer.
a trailer that would go to the schools under a crisis situation. My question was, where were they going to keep it? If they keep it in Lumps Park, where the regional office is, and there was a crisis at, say, Jefferson High School, by the time who's going to take the trailer down? That was my question when he was presented, how that was going, logistically, how was that going to work? And I guess
We can clarify the logistics with Scott and get that information back to you. The program was approved, the meat of the program, are the trainings that they're providing to the school personnel, but I can follow up on the trailer thing and get more detailed plan on what the logistics for that.
Okay.
I'd also appreciate Jason, my question was here was about sustainability after it approved, which it was. And maybe you could ask me that question too. He answered it, but I just don't remember. I think from my own memory to jog it, I'd like to know what his answer for that was.
Okay.
Yeah, thank you. Sorry, I had to kick that thing in the curb.
Okay, we have the motion, so any other discussion regarding the accelerator awards going forward for the
Jason, we provided a link to these three proposals. That's what we'll then vote on after. If this passes, we will then get more information and we will score.
you will score these
So
particular.
having reviewed them, when I scored.
Oh, definitely. I mean, you're not even really reviewing it yet. You'll get the scoring rubric and be able to.
On paper. That's what I got. Thank you.
We'll keep you busy.
Okay, thank you.
Okay, so, this has no money attached at this point, so all those in favor, please say aye. All same sign. Okay, thank you. Moving on to updates to bylaws.
Sure, I'll provide a just high level overview and a reminder for new board members coming in where we're at with this, and then I'm really going to defer to legal counsel who is coming on to come be with us in person today and really drafted these policies and procedures to make sure the board maintained continuity and compliance with any state statutes. So over the past several legislative sessions, there have been numerous changes to the Community Mental Health Act. A lot of that has been instigated by new township boards in the suburban areas who are having existential crises because they're having ballots that get passed, they're not being honored by the governing bodies. So you can follow some of these newspapers in the suburbs and get into the weeds with it if you'd like, but that has created, so there's been numerous changes to the Community Mental Health Act. There's been a change to the Open Meetings Act. And so when all of these things came through and we took a look at the bylaws and policies and procedures, there was really an actual need to update some things to get the bylaws back up to date. So I engaged Brandy, Attorney Quantz's expertise in this, and she was kind enough to really take a look at where we were and the changes that had been made to some of these state statutes and propose bylaws and policies and procedures that would get us up to date and maintain compliance with state statutes. So that's my background on it. I'm certainly happy to answer questions, but really would probably defer to legal counsel on most of this.
So I will go through each one of the resolutions that were drafted by our attorney. And we will need to have a motion for approval. So, and they explain exactly what she changed. Well, she didn't, the law. First of all, it's resolution 2024 X4.
I lost first.
Okay, all right, so we have to approve updating our bylaws. That is a separate item. So we need a motion for approval of our updating of our bylaws. Terry, Mohammed, any questions?
Just these bylaws, so our attorney, these have to be done, Illinois, all kinds of laws that we have that are passed, this has to be updated.
So the Illinois Community Mental Health Act changed, so you had stuff in your bylaws that didn't meet the Community Mental Health Act. For instance, there are 2 new members. They weren't in there yet. We were still a 9-member board instead of an 11-member board. So it's the changes like that came.
That just happened just for our community, correct?
Yes,
To
for the 2 appointments. Yeah. But there were other changes. There's other changes too. Like if you review the responsibilities, the wording and some of that changed. The membership changed, and then there's a establishing a policy and procedure for the mental health board to advise the appointing authority on applications for members to the board. So all of the changes to the Community Mental Health Act have been put to the bylaws.
All right. Okay, so I need a motion for the updates to our bylaws. Oh, sorry. Okay, I'm getting.
That's a
All right, so
Before we go, we haven't marked this track. So are we doing this today, final, as if it's final approval?
yes,
Could we ask for a little bit more explanation of kind of like what the changes you made? Because I've seen the mark. But just, if you would, for example, I'm responsible. Would you mind just kind of sharing that piece of the changes?
Sure. If you look up the Community Mental Health Act, the wording in section 1 under Article responsibilities, it doesn't mirror it, but it basically repeats the responsibilities from the act.
Okay.
Yeah, one thing I could comment on in section 5, for example, the 120-day requirement extended to 180 days. Many mental health difficult to complete annual reports in 120 days because we have grants that are expenditure reimbursement and often lag. And sometimes the fiscal year, while it may end on one day, it doesn't actually, it doesn't close out sometimes for 90 days later. And it's just very difficult for everyone to pull that together in 120 days. So just that's one example of a very minute detail. Just
Yeah. I was just gonna go through a couple more under our responsibilities, section 3. That just updated both the county board and the mayor boards. Under membership, we discussed that it's now going to be both the county board and the city of Rockford that are going to appoint. And the mental health board to establish a policy and procedure for submitting applications to the mental health board for appointees, and then they'll make a recommendation to the county board and to the city. And then under Article 6, officers, that is just cleaning up. I think we had some question as to what happens if the vacancy occurs, when timing as to when it occurs. There. The duties of the officers, section Article 7, section 4. That took out the treasurer collaborating with the president to submit the budget to the county board. And that's a change in the law. So that just mirrors the Community Health Act where the mental health board is in charge of the budget. So that doesn't take away any cooperation or anything like that. I think those were the major changes. Yep.
I ask a question back on 5, section 3. So this board shall establish policy and procedure for the acceptance and review of applications from interested residents prior to making a recommendation to the county board chair or the mayor. How will that be done? We don't have that yet. A policy
Is number 9 on your agenda.
Right,
okay.
I'll be,
Got it.
okay, any other questions? Okay, hearing none, all those in agreement, please say aye. Opposed, same sign. Okay. All right, moving down now to the actual resolutions. First one, 2024, X4, resolution amending rules for meeting attendance for the Winnebago County Community Mental Health. So that rule was amended. So does anyone put forth a motion for approval?
Okay,
Any discussion?
be on time.
Pardon me?
No, attendance, be on time.
So the addition is the unexpected child care obligation.
Pardon me, Billy?
The unexpected child care obligation, that's the addition.
Correct. There was a change to the Open Meetings Act, and that was an addition that was made by the governor following COVID.
Okay.
Okay, any other? Hearing none, all those, please say aye. Okay, resolution 2024 X5, a resolution deleting a policy of advisors for the Winnebago County Community Mental Health. And as you recall, we used to have advisors and it was advised. By legal, that we do not have regular advisors. And doesn't mean that we can't have advisors going forward.
Read it, sorry.
Right.
So legal, the advisors, we still are, can and cannot have advisors, it's just kind of a whatever we want. So I read it, wasn't sure how that, because we did have advisors at one time, so we can still have them, but it's not necessary.
Correct. If
Okay.
you ever need like specialized assistance or something, you know, outside of the realm of the
Yeah.
support,
Okay.
then you can always see additional. But I would say that's more of a piece.
That's what I want to say. Basically, I was a case by case, it's not on all things, but you know what? It would be nice, if I was thinking, it'd be nice to get, you know, some advice from that person who's more directly involved, because that's what's one that we can use. Okay, that's fine. Thank you.
Not as a standard attendee.
I mean, the board, these are the people that are making the decisions, so these are the advisors, so to speak. You need some.
Okay, any other questions? Hearing none, all those in favor, please. I thought I did.
Sorry.
Well, the discussion shouldn't have taken place in before, yes. Okay, Bill, did you say, and then Carrie? Okay, now we have first and second. All those in agreement, please say aye. Opposed, same sign. Okay, thank you. The next resolution is 2024-X6, a resolution adopting a policy for accepting and reviewing applications and making a recommendation to the appointing authority for the Winnebago County Community Mental Health. This is your, but anyway, we will need a motion for approval. And then discussion. Okay, I need a second, Barry. All right, now any discussion? Bill, this is your question.
Yeah, I read it quickly before, I'm just looking at it. Get it?
I have all kinds of questions, but I'll adjust. Okay.
Any other comments, questions? Good. Well, I guess Bill doesn't have his question. No, okay. All those in favor, please say aye. Opposed, same sign.
Me,
You're opposed?
yes.
Okay, and why are you?
I have reasons. I just think that this is something that we needed to have more information on. Nothing to do with our new members. These are good people. These are good people, quality individuals. Just didn't like the way the legislation was written. And I will make, when we talk community matters, I will voice my opinion on that.
But as I understand this, making it clear that the board gives input as to our recommendations and the applications would come to us. And, you know, then the county board from there could.
I wish that would have been in the first.
Okay. Yeah,
But to clear what he asked question on, this is just to get this is something even more so than with the new legislation. That's something that we it's so that we have some say so when the chairman or the mayor just appoint somebody, they can't just put anybody on the board. They have to put the rest. So that's what this is for. This policy is for specifically.
Okay, okay.
So
And this is what I would want to begin.
right.
Okay, so then I would have to approve. And I'm in, but I, well, understand where I'm coming from.
Now that you open the door a little bit.
Yeah.
Okay, well, based on my earlier question, I did look at. So, the wording of our policy is a recommendation. I agree completely with our two wonderful board members, nothing to do with you two at all. But is the recommendation can either be taken or not taken by the chairman or the mayor, is that correct?
Correct.
I mean, it's not aware of it.
It's a recommendation.
The implicit, I just want for clarity.
Right. Well, we assume we have a cooperative agreement, and we respect each other, and we would hope that,
Technically speaking, it is only a recommendation, it's.
Right.
Okay.
But with this policy, they have to submit the resumes before they approve.
There are steps.
So with us having this policy, we get the opportunity to look at the resumes before they even say, instead of just pop up, we got support. Because we still got a vacancy.
Can we take a moment to clarify Terry's vote then? How would you like the vote to be entered? And just
Well, I guess,
covering this.
when I read it, maybe I read it opposite. So again, this is a legality that I don't tread water much in. But I will, after Tim's explanation, give an explanations. Okay. Yes. Okay.
We have 40 years. Okay, resolution 2024 X7, a resolution establishing and recording rules for public comment for the Winnebago County Community Mental Health. Do we have a motion for approval? Okay. Second. Jeff? Any discussion on this? Questions? Hearing none, all those in favor, please say aye. Opposed, same sign. Okay. Moving on down to the discussion items of the FY 24 impact videos.
All right, I'm going to some of our communication, it's things that really started conversations that started a couple of years ago about it's great that they're doing these programs, how are we getting information out, all the things that have happened since then, engaging a kind of ad hoc communications working group that is still meeting together with marketing and communications professionals from some of the funded programs, not all of those who have volunteered to participate in that. Chelsea continues to lead that, and they meet every 2 months. The establishment of the communications requirements that went into place, working with Portrait Creative to create that communications toolkit, which has now been updated for the new program year. And what I want to show you is really cool results, which is a screen share here. So those following along can see it. Our YouTube page, we now have a slow internet connection. Big reveal. Videos, every single funded program from year 24, taking the time anywhere from 1 minute to 19 minutes. The recommendation was given 2 to 8, but some really have lots. And we have some of them combined, also multiple programs in one video for one. So we've got 35 total videos. And, if you're willing to stay a few minutes, I would like to just give you an example of one of them. It's not because it's the best, but I thought it was a really good example of what we were trying to achieve with this. I'll play this for you And I probably messed up the signatures.
In-house staff to provide behavioral health services. Instead, Crusader contracted with one licensed clinical social worker to support patients and their mental wellness. Now, a decade later, Crusader employs 22 behavioral health staff with plans to expand. 12 of those 22, more than half, are paid for with funding from the Winnebago County Mental Health Board and voter-approved half-cent sales tax.
The taxpayers of Winnebago County recognize the need and the importance of mental health in our community, and we're just grateful and thankful that the voters approved the referendum to provide this support for us, and we're very proud of the services that we've been able to offer and the help that we've been able to provide.
Crusader Community Health provides Northern Illinois with comprehensive, affordable, and accessible medical, dental, and behavioral healthcare services for anyone in need. As that need has grown in our community for affordable primary health care, including behavioral health services, Crusader Community Health has expanded. With support from the half-cent sales tax, our services are more robust than ever.
If you're a patient here, you're able to access behavioral health services because behavioral health care is health care, and those things are integrated here.
That integrated model of treatment means mental health services are provided in a primary care setting. Patients can receive their primary care and behavioral health care all under one roof with collaboration and coordination.
We want to be seen as the patient coming in, that we are just a piece of their health care and that we're a part of their team.
Crusader provides behavioral health services for children, adolescents, adults, and families, like assessments, diagnoses, therapy, psychoeducation, relapse prevention planning, crisis intervention, and treatment recommendations in collaboration with medical providers.
We recognized how important it was that good mental health care, good behavioral health care is necessary in order to get good medical care and medical outcomes for patients who need that.
That additional investment is refreshing. Will Holm, now the department chair for behavioral health, was the lone LCSW Crusader contracted with a decade ago.
It's been a welcome change. Being in the field as long as I have, I remember back when mental health was really kind of marginalized and there was not a focus on mental health. Mental health, substance use, this is becoming recognized, and that it's serious. It impacts anyone and everyone across the age span, across socioeconomic. It has no boundaries that way.
In this program year alone, Crusader added another behavioral health case manager, a part-time child and adolescent psychiatrist, plus a licensed professional counselor to specifically support women's health patients.
To have this fund available for Crusader and so many other organizations to really try and be more comprehensive in meeting community-wide needs is really spectacular, I think. But then kind of taking a step back and looking community-wide, I think it's great that our community is able to acknowledge this is a need that we have and we're going to take action to make some improvement there.
The increased access, turns out, is exactly what patients both want and need. Recent behavioral health patient survey data show 94% of patients were able to get an appointment exactly when they wanted it. 97% of patients said their provider spent enough time with them. 91% said they felt heard, understood, and supported by their case manager. 93% were motivated to use the information they received in their appointment.
It's incredible the feedback that we're getting, that they're able to access appointments when they want, but more importantly, that they're seeing a benefit, and it is making a difference, and it's improving their lives. And it's neat to be part of that. With these resources that we've gotten, these sales tax dollars, we've been able to see that what we suspected was true as we expand access to mental health services, that patients do receive higher, better level of care and adherence to not just in the behavioral health area, but also into the medical, as they interact with their medical providers and actually end up with a higher quality of life.
This funding increases accessibility to address patients' needs and reduces barriers to their care. On behalf of our behavioral health team and all of us here at Crusader Community Health, thank you for supporting our patients and our community.
You have time for 34 more?
Yeah.
Tell you what, let me go read those applications. You can all do it like that.
So there's a playlist, we'll keep playing through on there. We've already seen numerous organizations sharing these videos through their newsletters and their social media. I think Chelsea had an organization that reached out to her and said that they had watched some of the videos in their staff meeting and how helpful it was for their clinical staff to learn about what other programs are. So I just appreciate all of the community effort that went into this, but really Chelsea as well for leading the charge and it's a big one.
Just one quick thought. The renewal of the referendum, the timing is what again? Spring of?
No.
Fall of
This fall.
this fall.
No.
Yes.
So, ask me the question.
The voters vote to renew the absence sales tax for us. Is this fall?
It's gonna go on. So if it get passed by the minimum, by the company, but we still have to do it again in the next
Right.
2 elections after. So it's not.
So the community votes will.
So we just say if it doesn't pass November, you go put it on the ballot.
Okay.
At next lunch.
Okay.
But we do have an interest in
See what happens.
Well, these types of things in a more condensed version for mass consumption
right.
are incredibly important
Yes.
tools to reach a lot of people.
So,
So
okay, moving on to the second last accelerator board program. Right?
Well, no, we're gonna do one presentation here. Mark has really done a great job in this up and running, so I wanted him to just give you a quick highlight of this program and kind of how we see it kind of wrapping up here.
In the same vein of being able to present to not only you, but the public at large about the update on this. So basically, the Accelerator Award Program was created due to a budget. So we have about $10 million, and we wanted to make sure that we injected some capital into one-time projects that have kind of a meaningful impact to mental health care and substance abuse care services in Winnebago County. The application was opened about 9 months ago in December of 2023. And as I said, it's about a $10 million budget, $2 million the proposal. And like we said before, that it would be spent within 24 months. So this is what we've done so far. So basically, there's been 10 awards awarded for a total of just over $7 million, about an average of $700,000 per project. The highest of that is the University of Illinois College of Medicine, Rockford, at $2 million. That's the one we voted to extend the timeline on. So that's a bigger project that has a lot of facets to it, and that one is $2 million. And then the smallest one was Winnebago County's Justice Involved Peer Navigator program at $35,000. So a wide range in there, with a lot being towards that average of about $900,000 in there. Within that, the spending is kind of broke down. When we talk about physical, social, and human capital, when it's capital needs, it's more the physical capital. So about 60% of the funding has gone to physical capital needs, construction, building, vehicles, etc. And then the rest has gone to programming and operations. So, if you're starting a social worker opportunity, track, other, types of, spending that would be for operations and programming, that turns out to be about 40% of the total in that. And in there, basically, spread out over these next 2.5 years, because you did vote to extend, that one there. But we have 3 right now that should be spent before the end of 2024, that should be, paid out entirely, and that's the Summit Academy project. That was the, playground project, Marshmallows, Hope, and then Winnebago County. So right away, a little over $1 million is being injected into the capital, capital being injected into the system and having an immediate impact, which is great to see. From there, in 2025, almost $2 million will be spent out of that when it actually gets final, and the final $3.8 million so far will be in 2026 and 2027. Throughout this entire timeline, payments will go out as the projects go. The accelerator program is a little bit different in terms of how it's paid out. It's not paid out by having every receipt for every screw and hammer purchased. It is a paid for deliverables. So basically, once these grants are awarded by you folks, we talk with the organizations and set out with them based on their project, what markers along the way of this project are on there that shows progress. So 25%, 50%, 75%, 100%, generally on there for the projects that are a little bit bigger. And that just keeps accountability up, make sure that we're getting constant feedback from them about how the project is going. And then it kind of helps them move the project along with those payments. So it's a really good relationship builder and relationship sustainer to organizations that are being funded to make sure that that accountability and that feedback is on a consistent basis. There. So what's next? Basically, we still have a little under $3 million. We do continue to see a lot of interest in this program from local organizations. We did recently receive 2 letters of interest. One of those letters of interest completed an application right away on there, and we're still waiting on another application as well. However, we do kind of want to create a sense of urgency about this. The capital that's being injected is going to have some big impacts. But we want to make sure that everybody's kind of getting on board with any projects they might be waiting on. So the idea would be to create a deadline on this that would be a little bit about a year, a little over a year, to make sure that anyone that does have projects that they want to start working on, that they would submit applications for, that they would be worthy of funding on that. So if if that's kind of not approved, but it is agreeable, then a resolution would be written for next month to start kind of closing down this process in terms of asking organizations to come forward with any projects they want funding for.
Yeah, so to be clear, what we would like some feedback on is if we should really establish a hard deadline for accelerator applications. Coming up in December, for a year. I think that's been a sufficient amount of time for organizations to apply. And not only does it create a sense of urgency, but if not more quality applications for this program, it would allow for the board to reevaluate funding and potentially allocate that elsewhere. So we'll get your feedback, and based on that, we can create as Mark said, resolution or action item for future board meeting. Any thoughts?
Yes.
Yes.
How do people become aware $2.9 million out of organization? Would just come to us and ask if we get money, or how does it?
Yeah, and so I think that many of the organizations in the community have been aware of it. Because we've received a lot of letters of interest, questions, and commentary. We put it out through not only press releases, but through other communications channels that we have. We've become the mental health board is pretty popular in Winnebago County, so most of the nonprofit organizations are pretty well aware. And with the accelerator, is I think because it has been open for such a long period of time, we've seen nonprofits otherwise program funding that have applied or done a letter of interest for the accelerator program. So I think people have been aware. It is a unique thing, and if you have been in an organization that writes grants, not every idea is one-time funding, spend it out, and create something. A lot of types of ideas. We need long-term program funding, and this was really intended to be something different, so it doesn't meet every need.
So there's no formal way of public knowing that the money is available for this kind of program.
We've put the information out. Yeah, we put it out.
How we do that?
Through press release, through presentations. There's been multiple ways that it's out, and on the market, we have total tally on all the letters of interest and applications. What is the total number of letters?
It's been 38 that we received.
So 38 different letters of interest have been filed over this time. So I think the awareness, I don't think it's an awareness issue that we have money left. I think it's that this was a narrow type of funding and that not everybody has had that particular type of need.
We don't anticipate having that type of monies, those type of monies.
Here, right.
Maybe follow up on Tom's question, if when we decide on formal adoption of resolution for a hard stop date, and would that then trigger an announcement?
That would be a very good time to do. So I think that would be fair to let everybody know in a very public communication. Now there is a hard deadline, it's going to be forever.
Jason, you said press release a couple of times. Not trying to demean anybody, but the business community, sporadic events. That goes to the news outlets, because they may pick up a story, but they may not when you see the news. Exactly.
When we do a press release, it goes to a variety of, we essentially have a list of organizations and partners that includes news media that it will go out to. But I agree with you that that's not the best way to reach saturation, depending on who your target audience is. So for our funding opportunities, while we will do a press release, we also try to do presentations directly to the organizations that are seeking funding. And that could take a variety of approaches, from direct presentations through different network meetings. We have a quarterly meeting that has all of the funded agencies that the mental health board funds to explore program grants. So we'll give updates at those network meetings. We'll attend other network meetings throughout the community that might include additional nonprofits, healthcare organizations, or even private practice, and try to share the information through a multitude of meetings. And we have a mention that anyone that's interested in signing up in a subscription list.
But you are all the time dealing with that but if someone is new, want to start something, some program, how do they know that this kind of thing?
I think that's a big question, but this funding program is not a startup program.
No.
Right, so
here's what a startup. Then you can people around them, you need certain, they will want some kind of, how
We're happy to share the information in any particular way. As if it is a presentation to a meeting that you're aware of, we can go out and do a presentation. We can have a print version of something, a flyer. We're happy to. If you're aware of additional networks or channels that we should be pushing out information. Yes.
Okay, programs is apply for the accelerated money. That would be a program like a symposium or a mental health fair or something like that. Do those events qualify for the accelerated program?
I wouldn't rule out that necessarily for accelerator, as long as I don't think that would disqualify. I mean, I think it has to really look at the specific criteria, but there's nothing in the notice.
One of the things, I'm going to be talking to one media. Well, I was asking Jason a couple things. To show you the magnitude of how we can change human services in the community. Through our grants over these three times, we put 135 mental health professionals in the community over that period of time. And now we're at a point where, over the last quarter, almost 7,000 people that service through one or more of the agencies. So it's the dream is happening in terms of getting an array of services that can help.
No doubt. Okay, we have nothing under other matters. Yeah.
I'd like to make a motion.
Give me a second. Okay. All right. First, Angelo and Jeff, welcome. I've heard nothing but good things about you. And I mean that when we were told that we're getting 2 new people, I was opposed. So I want you to hear from me, okay? Not a rumor or because last one, I made it very clear how I felt about this. Now, I have not never met. Day till today. I said for good things. And I'm impressed that the mayor chose to call me for what reason, I'm not sure that. But I hope the mayor in high regard. And I mean that sincerely. I think the mayor, his heart is in the right place. He's had to deal with some very difficult situations in our community, and I think he's handled it very well. And I mean that sincerely. I don't always agree with how he does things, but that's why disagreements only make strength. Okay? Now, Jeff, I met Jeff over times. Over 25 years ago. The late Dr. Clyde Snow was here, the forensic anthropologist on a murder case. I was during my internship. I know some everybody in the other world. And Jeff and I, we met briefly, and then what? About a good dozen years later, we were put on a panel called Deferred Prosecution Panel, which here in Winnebago County, if anybody was low-level felons and misdemeanors, Jeff and I, along with about 4 other people, listened to their reasons for what they did. We would recommend to the state's attorney's office either put them on probation, get that clear off the record, or recommend that maybe they should further ahead with the prosecution. I learned a great deal from this man, a great deal. I admire him, I respect him a great deal, and because of those things, I'm glad he's here. Now, last month, I made it really clear that I thought the appointments were not needed. Okay? I'm not sure, legal, you can beat me up over this. I probably haven't come. But I always want to know that I didn't think that the legislation, to make it really clear how it was past. It was only done if the doctor did it. I'm not sure the reasoning behind it. And the purpose. I'm a reason and purpose driven person. You gotta give me a reason and good purpose why I'm gonna do this or why I should accept something. And I just needed a good reason and there wasn't. But knowing the two of you, knowing what I know of John, of course, I welcome you. I'm not on a good note. Okay, even though I didn't want you to hear a rumor, that Jardine said this. Okay, okay, but this is how it's gonna be across. But I am glad you're here, glad to see you too. I welcome you. I look forward to you watching or listening to you guys read those applications. Two more. Yes. Last one. Hang on. But anyways, welcome guys, and I mean it sincerely. I think it's a wonderful opportunity. Marcy's new to us too, so she's learning some new things and she has some questions too. She's been really good about this. And this is just, it's a good board. I mean, we have one hidden plan and that's to come back. Come back. And that's what we're going to do. Okay? And on that note, that's it. All right, done.
I like to move to make a motion.
That's right. And we're all there.
All those in favor?
All right.